Welcome back, everybody, to our digital town hall. We're sitting with Governor Asa Hutchinson and Dr. Nate Smith from the Health Department. We are answering a host of things and trying to get to as many questions as we possibly can, continuing now on KRK and Fox16.com.
That's exactly right. You know what, I had a question for you, because when I look at national news, Dr. Smith, they talk a lot about African Americans and how more of them are not only contracting the disease, but more of them are dying. A much higher percentage are dying. I look at Arkansas numbers, and I was listening to you yesterday, and that's not the case here. Why do you think there's a difference in Arkansas?
That's a very good question, and we're watching those numbers very carefully as well, and very, very concerned. The virus, I don't think, selects one group over the next. In Arkansas, some of our first cases were in Pine Bluff, which has a higher African American population, which may be why we have a slightly higher proportion of African Americans amongst our cases than our population. But we've not seen a huge skyrocketing disparity there, but we're watching that very carefully. We want to make sure that people are protected. We want to make sure those messages get out to all of our communities, and we want to make sure that those who get sick get the highest quality care that's available.
Okay.
Got a question coming from Matt from Magna Cove. I believe he asked, there was an announcement that nurses would be getting an extra $1,000 a month. Where are we on this? Will that include CNAs or RTs?
Great question, and we have to have a waiver from the federal government, CMS, in order to accomplish that objective. And I do believe that when you're looking at the direct care personnel that's dealing with the COVID patients, that we wanted to be able to give that extra pay. We're trying to get Medicaid to give us the waiver. We have not received that yet. And so we recognize the need that's there, the deserving nature of it, the risks you're taking, and we hope that we'll get to the point that we can provide some level of extra compensation.
And some hospitals in the state have had layoffs, you know that. Do we have enough staff for the immediate need, and especially when you look at them, or you look at this situation long term, will we be able to provide medical care to everyone?
Well, this is a little bit of the irony of where we are. You know, in one level, we're planning for such an escalation that we don't have enough hospital beds, and we're having to use temporary facilities in Arkansas in the event we have such a large breakout. Well, you know, we're not reaching that point, and so in the meantime, our hospitals are having to lay off workers because they're not doing elective surgeries, and they're not having the business they ordinarily do. People are postponing these type of doctor's visits, and so the healthcare industry, while they're on the front line and doing an incredible job in this COVID-19 crisis, they're also struggling financially in many areas. And so we're going to have to fill in some of that gap. We're going to have $1.2 billion coming in. It's primarily going to be used for COVID-related cost, and so it'll help some with our hospitals particularly, but we're going to have a lot of makeup to do when we get back to business in our healthcare industry.
Okay.
On the topic of healthcare and economics, this one coming from Wanda in NOLA. She says, we as a state need to reward our healthcare workers for risking their lives and their families' lives. Is there a way to wipe out all active nurses and doctors' student loans away if they're working in hospitals, etc.?
Well, I don't have that power, but I certainly understand what you're doing from a distance, and I'm grateful for it. And as Dr. Smith said, y'all are the heroes in this, and all of Arkansas is grateful for what you're doing.
You know, this next question, it's on my mind constantly. Mary from Bentonville, she writes, I think all women want to know, when are we going to open the beauty shops and nail salons? Because we're struggling right now.
Well, my daughter, Sarah, she was thinking about how you reopen business again, and she dreamed that the first thing that would open would be the hair salons.
Of course.
And so, Dr. Smith, how do you see us being able to reopen?
Well, I don't know if I can answer that question without getting in trouble with someone. And we would love to open as many businesses as soon as possible, but just by the very nature of what barber shops, beauty salons do, it requires close contact, and that puts people at risk. as we are able to do that safely, we will do it. But I wouldn't want anyone to unnecessarily become infected because we move too quickly.
You know, we had a story last night from a woman who owns a shop, and she was wondering, why can't you implement, or why can't the CDC, actually, she said, implement some guidance where only a few people in at a time, you know, everyone wears the protective mask, PPEs, all of that stuff. She was wondering, why can't you do that so that we can open some of the salons? And mainly not because women are saying, well, I need to get my hair done, but because they are losing money.
Well, I agree. And I think we probably will come up with guidance. We probably won't open everything back to complete normal. We'll take some steps. Right now there's a shortage of PPE for our frontline healthcare workers, so we really don't have the option of dressing out our cosmetologists and beauty salon personnel in that kind of PPE. But as we move closer to that time when we can start opening them, we will be looking to guidance from CDC and developing our own to make sure we open as quickly as possible, but also as safely as possible.
Okay.
Governor, here's another economic question. This comes from James from Rogers. He says, when will people who need unemployment and small business loans receive the support they need? I know that you guys are working diligently and even expanding the workforce to try to get these things done. Any time frame?
Well, I mentioned in terms of the unemployment compensation, that should be with the federal money the end of next week, hopefully sooner, but end of next week is what they've been told. I've been told. And the other question is about the self-employed, the gig economy, the barbers, those that have been unemployed but don't qualify for unemployment compensation. That money we have to set up a new process for. Just think about it. We've never, as a state, had that kind of a system developed. We don't have their names in our system. They got to go through the application process. We've got to build the IT system. And so while that money will be coming, it's going to take us a couple weeks to build that system. We're working on it. We want to get that money out as quickly as possible. But it's going to take a little bit of time.
Amy in Little Rock, she actually said that she was unable to get a test, but she got sick. She believes she had COVID-19. She is wondering, when can I get an antibody test, just to see if she had it, and maybe she could be beneficial to some of the current patients.
Yes, those antibody tests, or we also sometimes call them serologic tests, they're coming online and they will be a part of our testing in the future. Right now it's most important that we identify those who are actively infected so we can prevent the spread. But those tests will become more available, and we'll be able to answer some of those questions for people.
You know, Dr. Smith, I've spoken to a lot of people, and this goes back to December when people said that, you know, I've had a fever, I felt like I had the flu, I was down for a day or so, went and got tested, it was not the flu, don't know what it was. What are the chances that this has been kind of skunking around for a while and people have had it and they've got over it?
That's a very good question. I've gotten that question a number of times myself. Unfortunately, this time of year, we're coming out of it, but in this early spring is when there's a lot of respiratory viruses that are going around, and even seasons when we don't have bad flu season, or certainly don't have COVID-19, people get sick. Now, of course, people are asking, you know, is it COVID-19? In those settings, when we've tested, we've generally found negative results, but it's important that we scale up testing so we answer that question not just most of the time, but all the time.
Okay. Very important question here. All of our questions very important, but this one I like specifically. Gary from Cabot, he says, are there any plans to let operators purchase items in sufficient quantities? He has a daycare, so he is wondering, he needs sufficient quantities. For example, milk limited to 1 gallon. My facility uses 10 gallons, or excuse me, my faculty uses 10 gallons per week. Cleaning supplies, also hard for him to get. They're essential to keeping those daycares clean. He provides care to 100 children a day. What can he do, and how can the state help him, first of all, get the money to do it, and also be able to get ample supplies?
Wow. Well, first of all, that is an illustration of the importance of that center that takes care of the children in a very responsible way, obviously wanting to have the cleaning supplies and protective gear that's in place. There's not an easy answer there, and so we got to work on the supply chain. You know, I'd like to see our Secretary of Agriculture maybe try to be creative and try to find some ways to help. So I'm glad you raised that question, and we'll see if we can't find a better answer for you.
I'm sure if he's experiencing this, other daycares are as well.
Well, they are, and as time goes on, the pressure is going to be relieved, and that's why it's so important to keep that supply chain for milk, for cleaning supplies, and that's why we shouldn't be doing panic buying, because everyone needs that, and the supply is going to be there. We don't need to hoard it, and I think if the owner talks to some businesses, they know your needs. They're not going to put a 1 gallon limit when you know you need more. Check with your Walmart suppliers, check with the other suppliers out there and tell them your need. I think they'll work with you on that.
Okay.
Governor, Dr. Smith, gentlemen, thank you very much for your time this evening. It's been very informative. I know a lot of folks at home are happy to get their questions answered. And I think we answered quite a few questions this evening.
Yeah, thank you very much. And that's going to conclude this for us. Thank you for joining us on fox16.com and KARK.com. As always, we like to tell people, stay safe. We know it's been tough, but do stay safe. We will get through this. So long, everybody.
We are the strong ones, stronger together. This is a time for rising up. Being apart is bringing us closer. It's bringing out the best in us.